Right, I think we're ready to go. Good evening. Welcome, everybody. Thanks for coming to the BFBA webinar on equine laminitis, an update for this age-old disease. Really good to see so many people here. I think we've got 61 people in at the moment. My name's Dan Harmon. I'm not actually Holly Flack. I'm going to be Dan tonight. I'm a farrier. I'm also on the executive committee of the BFBA. If you don't know anything about the BFBA, we are an association with over 1,000 members. Amongst other things, we put on a lot of CPD events, not just farrier related or hoof care related. We also put on CPD events for first aid, well-being, mental well-being, and physical well-being as well. We have our flagship event at the end of September called Focus. That's a 2-day event held at Stoneleigh where we have an international shoeing competition. We have lectures from world-renowned farriers around the world. We also have an international bladesmithing competition, blacksmith competition as well. So that's a really good event. If you don't know anything about us, then it'd be good if you could either like our page or even better, become a member. We allow, obviously, farriers that are on here should be members. That'd be great. If you're not, please be one. And allied professionals as well. It'd be great if we could see some of you guys sign up. So why do we put this on tonight? As many of you are aware, there's been a lot of misinformation circulating on social media about laminitis. This can be extremely damaging, and it's really important that we all work together and get the correct information to protect the welfare of our horses and ponies. So that's the main reason we're here. Getting the correct information is really important. Not only do horse owners need this information, but it's also imperative that farriers and allied professionals can pass this information on to our clients and help prevent any damage to our horses and ponies. Hopefully this will be part of a mini series. We've got 2 more events lined up in the new year where we're going to focus a bit more on nutrition and farrier treatments. I think that's it from now. So I'm just going to, a bit of housekeeping before we go. If you could keep yourself on mute, that'd be great. Any questions, please can you pop them in the chat section at the bottom of the screen. And Nicola won't be able to answer any personal cases of your own ponies and horses. So if you can keep the questions generic, we'll try and get through as many of those. My learner friend Liam here is going to go through the questions at the end, and hopefully you can get through as many of those as possible. So I'd like to welcome Nicola Menzies-Gow, our speaker for this evening. Nicola graduated from Cambridge University in 1997. She spent 3 years in practice in Essex before starting at the Royal Veterinary College. She completed a PhD in equine laminitis at the RVC between 2003 and 2004. And in January 2005, she became a diplomat of the European College of Equine Internal Medicine and took up a position of lecturer of equine medicine at the RVC. Nicola was promoted to senior lecturer in 2011 and to a reader in 2017. She's also a European and FRCVS specialist in equine internal medicine. Thank you very much for coming tonight, Nicola. I'm going to pass over to you and really looking forward to the evening. Thank you.
Thank you very much. So I will do the age-old thing of sharing my screen. I have to click the right buttons. Oh, it's just being a little bit slowing and going into presenter mode. Oh, hang on, it's jumped forward. Okay, is that looking good, Dan? Can you see it as a perfect? Okay. So as Dan said, I work at the Royal Veterinary College. I've been there for 25 years. And it was when I went there was when I started doing research into laminitis. And I've been doing it ever since. I remember distinctly, in about 2005, I went to a conference that was organized. There were specialists around the world, that were all focusing on laminitis, and the strap line at the end of the conference from 2005 was that by 2020 we were going to have solved laminitis, and I can tell you now that we have not yet solved laminitis. We're a lot further forward than we were. We know a lot more, but we haven't yet got all of the answers. So I will give you some of the answers, but there will still be some areas where I say we're still working on that. We haven't yet got all of the information. So starting off, I'm sure because you're all here, you appreciate why laminitis is such an important disease, and why we as vets, farriers, owners need to worry about it because it's a very common disease. I've got percentages there of somewhere between 1.5% and 34% of prevalence. That's sort of how many of the horses and ponies worldwide are affected. Probably that higher end figure came from a study that was done in Australia where they had a very specific population of pony club ponies. So it was quite a biased population. If you want a true figure for the sort of general horse and pony population that's within the UK, it's somewhere between about 3 and 5%. But that's still an awful lot of animals. If you think of how many hundreds of thousands of ponies we have in the UK every year, that adds up to a lot of animals. And when somebody did a study looking at what caused the demise of horses and ponies, it was having laminitis meant an animal was 6 times more likely to die compared to another one that didn't have it. Usually animals are euthanized rather than they actually die from their laminitis, but still. We know it's very painful, and we know it's frequently recurrent. So it's not like they have a single episode, you treat it, they get better, and they never look back. It's repeated episodes. And therefore, it has huge welfare implications. If we don't treat it, then the poor animal is going to be left literally in permanent, lifelong pain. So I'm sure you've seen animals with laminitis, but this is just a video of a pony that we had. I'll just turn in the RVC hospital at one point. You can see how painful it is. It's got some glue-on imprint shoes, and it's on every single known painkiller. It's on about 4 different painkillers. It's can't have anything more, and it's still that painful. So that's why we still need to do some research into this disease. So as a reminder about the hoof anatomy, I'm not going to go into all the ins and outs, but just enough to set the scene for how laminitis occurs. So if you remember, the horse is essentially standing on one finger compared to our anatomy, and its hoof is the same as your fingernail. And on inside that hoof capsule, there is a bone called the pedal bone, which is the same as the very little bone at the end of your finger. And the picture on the right-hand side here is showing you that pedal bone, and it's got one set of either lamellae or laminae. They're exactly the same. The terms just get used interchangeably. And so there's one set of lamellae on the outside of the pedal bone. And then we can see here, this is the hoof capsule with a second set of lamellae on the inside of the hoof capsule there. So these are the insensitive or the epidermal lamellae, and these are the sensitive or the dermal lamellae. And basically these two sets, what we call interdigitate, so they interlock to hold that pedal bone in place inside the hoof wall. And this is just showing you in a schematic of what it looks like. So again, these are the two sets of lamellae. They're like little trees with side branches that are holding together. This is the hoof wall here, and this is the pedal bone or the distal phalanx. It has different names that's holding everything stuck together and in place. And if you were going to sort of take a slice through that hoof wall and those two sets of lamellae and look at them down the microscope, this is what it would look like here. So again, we've got sort of projections of the lamellae with the little side branches. So they're called the primary and the secondary lamellae. And if you look at them in even more high power, you can see them here are little sets of cells. And what these lamellae do is by having all these side branches, it means that the surface area of the two sets of lamellae interdigitating with each other have about for each foot a surface area of 1 meter squared, which is much, much bigger than it would be the surface area if you literally just stuck the pedal bone to the inside of the hoof wall. And having that very large surface area means that those two sets of lamellae can try and withstand the forces that are trying to move that pedal bone within the hoof capsule. Because we've got two sets of forces, as you can see in this picture. We've got the weight of the horse that's trying to push the pedal bone down within the hoof capsule, and we've got the pull of the flexor tendons that run up the back of the leg that's trying to rotate the pedal bone. And it's these two sets of lamellae interdigitating that withstand those forces. But that's why when it goes wrong in laminitis and these lamellae aren't functioning as they should do, that the pedal bone can move in two directions. It can either sink under the weight of the horse, or it can get rotated so that the tip of this pedal bone here rotates down towards the sole with the pull of the tendons, or in the most unlucky horses, both can happen at the same time. So this is showing you the laminitis lesion. So this was somebody, and I'll play the video again in a minute. This was somebody who basically sort of cut a foot in half and then used sort of forces to see how the pedal bone moves. I'll make it go back to the beginning. And that's how the pedal bone is moving. And you can imagine how painful it is for the horse because you can see that the front of the pedal bone has moved a long distance. It used to be up here and it's moved all the way down here. And the tip of the pedal bone, again, is heading towards the sole here, just in front of the point of the frog. And that's why this is the most painful region for the horse and why sort of as part of the treatment, we take the weight off the painful toe region and put it onto the sort of the caudal 2/3 of the foot where the horse is much more comfortable. And you can see how the pedal bone, if everything continued, might end up sort of exiting out the bottom of the hoof here. And this is what it looks like again under the microscope. On the left-hand side, the picture labeled A is normal happy lamellae. The PEL is the primary epidermal lamellae and the SEL is the secondary, so the little side branches. And we can see that we've got nice, happy, sort of pink looking tissue. And on this side with the one labeled B, this is when we've got laminitis. And we can see that these little branches, these secondary lamellae, are long and stretched. And the pink tissue that used to be in between sort of the interdigitating lamellae has basically disappeared and it's all just pulled apart. And we've got some very unhappy tissue. So that's what's going on inside the foot. We used to try and make all types of laminitis fit together into one kind of pathway and one set of events that was going on. And what we've realized most recently is that actually it's not all the same. In fact, there seem to be 3 different forms of laminitis that have very different sets of events that set them off, and then sort of cascades of events that occur inside the horse as well. And it's only what you see in the horse, i.e. having its painful feet and bounding digital pulses, etc., is the only bit that's the same, whereas everything else is very different. So this is why we've now decided just for how these things get termed, rather than being a disease, it's actually a syndrome. And a syndrome is more sort of a collection of diseases. And so the 3 forms are now called sepsis associated or sepsis related. There's supporting limb laminitis and endocrinopathic laminitis. And we'll look at each of those in turn. But essentially, as I said, the end result is the same. You get loss of that strength of the 2 sets of lamellae holding themselves together, and therefore the pedal bone is no longer suspended properly inside the hoof capsule. And then if you don't do anything, it's not treated appropriately, then that pedal bone can move. And it's everything that's going on inside the hoof capsule that causes the pain that you then see in the lameness of the horse. So we'll start with the sepsis associated, or also gets called sepsis related laminitis, which is why I've put the SRL as well as that there. And essentially this is laminitis that occurs in really sick horses. So it doesn't occur very commonly, but we do see it in a small proportion of horses that we have in our referral hospital. And these are animals that have severe GI or gastrointestinal disease, which are cases such as they've got really bad diarrhea. They have had some kind of colic, so they've got abdominal pain where bits of intestine have become strangled and their blood supply have been cut off, and they've had to have surgery to take that bit out and join the ends together. So it's not the standard colic that you know is a little bit painful, needs 1 shot of bute or something, and then they get better. They're not the ones at risk. These are the really severe end of the scale where they're needing surgery to fix them, or they've got really bad diarrhea, and again they end up in the hospital with us. It can also be horses with pneumonia, and again that's what we call pleuropneumonia, where they have infections both in the lungs and in the pleural cavity, so the space between the lungs and the ribs. And again, these are really sick horses. These are not horses just have a bit of a cough. These are horses that got a fever, they don't want to eat, they're really dull and depressed, they're really struggling to breathe. And then the third category are horses that after they fold, the mare retains the placenta. And then it's because the placenta stays inside the uterus and it sets up an infection inside the uterus, which we call septic botrytis. And in all of these cases, what happens is that the body ends up absorbing toxins into the blood, either from the gastrointestinal tract or the lungs or the uterus. And it seems to be these toxins getting into the blood that set off a whole chain of events that ends up in the laminitis. We don't know what these exact toxins are. People used to blame something called endotoxin and think that was the cause of it. And whilst that does play a role, there are probably a whole sort of concoction of different toxins that are working together to set off the laminitis. And what seems to happen is that absorbing these toxins into the blood sets off a massive inflammatory reaction in the body, and the whole of the horse is inflamed. So if you took sort of samples from the horse's liver or its skin or any organ that you looked at, it would show that there was inflammation going on. But it just seems to be that the feet are particularly badly affected, and then you get the laminitis because the laminae inside the foot get inflamed, then they don't hold together as they should do, and then we get the consequences that we do. So this is sick horses, whole horse becomes inflamed, you get laminitis. So that's a very specific category. The next category that you'll see again that's very different is what we call supporting limb laminitis. And these are horses that are very lame on one leg. So in the picture, you can see we've got a horse with a cast on its leg. It'll be some kind of lameness in one leg that makes that horse pretty much not want to bear any weight on that leg. But it might be a fracture, it might be so that you've got a joint infection or a tendon sheath infection that makes something that makes them really lame. But it's not that leg that's at risk of laminitis, it's the other one. So if it's one front leg that's got the fracture in it, it'll be the other front leg that's at risk because the horse is putting all of its weight on that other leg because it doesn't want to stand on the one that's painful. And it seems to be not very common. You can see our incidence is only 0.02%. So that's a lot lower than some of the other types. It's probably the least common type of laminitis, but it seems to be the one that actually has the highest mortality rate. They seem to do least well. Even if you treat them exactly the same, you do all the pain relief and the foot support and the farrier and all the rest of it, they just don't seem to do as well as the other types of laminitis. And we don't know why. Because this type of laminitis has had the least amount of research directed at it, probably because it's the least common, so people kind of don't see it so much, so it's kind of got a bit ignored. What we do know from the little bit of research that's done is it's not a direct, what we call mechanical overload. It's not just the weight of the horse that's basically making the laminae pull apart, because that large surface area that you've got inside each hoof means that that's just not physically possible. The weight of the horse cannot overcome the ability for the laminae to hold together if they're nice and healthy. But what it seems to be associated is an inadequate blood supply to that foot that's being stood on all the time, because the blood going around a normal horse's leg is reliant on the horse walking. So it kind of steps and unsteps, steps, and every time it sort of loads and unloads its leg, that helps the blood go round. You know, you've got the digital cushion, it helps it pumping round and the muscles in the leg, etc. And if the horse isn't doing that because it's basically just stood on that leg the whole time, it means that the blood doesn't go around as it should, and it means that the blood vessels get squashed, and essentially the oxygen can't get into that foot. So it seems to be what we would call an ischemia and reperfusion injury. So it's a lack of blood supply that causes that. So that's very different to our sick horse that's generally inflamed that gets laminitis. This is a very lame horse in one leg that has a lack of blood supply to its foot that causes it. And then finally, the most common type of laminitis is what we call endocrinopathic laminitis, or more commonly, it's called hyperinsulinemia associated laminitis. And you'll see why that's the case as we go on. That's because this type of laminitis is associated with the animal having what we call insulin dysregulation. So it's having trouble with the hormone insulin in its body. And insulin's main job in you, me, your dog, your horse, is to control blood glucose levels, so blood sugar levels, and it is a very important metabolic hormone. But if your insulin isn't doing the job that it should do, then it can have fairly disastrous consequences. That's why people, for example, get diabetes if their insulin isn't doing what it should do. And then there's a whole host of consequences that you can get associated with that. So horses seem to get insulin dysregulation with two diseases, and we'll look at each of those in turn. So one is EMS, or equine metabolic syndrome, and one is PPID, which stands for pituitary pars intermediate dysfunction, that's most commonly known as equine Cushing's disease. And this type of laminitis is actually the commonest type of laminitis. And as I said, it accounts for about 90% of cases of laminitis. So that's about sort of 4 out of the 5% of the UK population that is getting the endocrinopathic laminitis. So how did we work out that insulin was causing this type of laminitis? Well, we first had some suggestions a very long time ago. I think the first papers that were published in the scientific literature were published in about the 1980s, when they noticed that ponies that got laminitis seemed to have higher insulin concentrations in their blood compared to other ponies that didn't. And then there were quite a few sort of research studies that came out. And then finally, some people in Australia decided to see what would happen if you gave large amounts of insulin to some perfectly healthy ponies. So what they did was they basically hooked them up to a pump that was giving them infusions of insulin to keep their insulin concentrations in their blood very high. Over a prolonged period of time. So they did this for a couple of days. And what they found that was by about day 3, so sort of 72 hours down the line, all of the ponies developed laminitis. So they had the signs of the laminitis when they were walking, etc. And then when they euthanized the ponies and they looked in their feet down the microscope, they found that they had signs of laminitis. But what they found was when they were looking at this, that there's no evidence, well, minimal evidence of inflammation going on in these ponies. And definitely it doesn't seem to be a lack of blood supply in these ponies either. So again, it's very different to our sepsis-related or sick horse laminitis and our supporting limb or our very lame horse laminitis. So then people tried to find out, well, yes, okay, it might be the insulin that's causing the laminitis, but how is it doing it? So what's actually happening in the body to make the insulin cause laminitis? And again, this is one of these things where I tell you, well, we're not entirely sure still. There have been lots of theories because we know that insulin's job is to control glucose or sugar concentrations. So some people thought, well, is it because there's too much sugar getting to the tissues inside the foot, because that can be damaging to cells? Or is it that there's not enough sugar getting to the cells in the foot, because that can also be damaging? But we've disproven those theories. That doesn't seem to be the case. So the theory at the moment that's got the most evidence to support it is that insulin, rather than binding to its normal receptor, because all the hormones that you have in your body have a receptor, so something that's on the surface of the cell that it binds to kind of do its normal triggering activity, is insulin can, as well as binding to its own insulin receptor, it can bind to a different one called IGF, or insulin-like growth factor 1 receptor. And when it binds to that receptor, it sets off a sort of a set of events that result in damage to the lamellae. So that's what we think happens at the moment. But I might give you a talk in 5 years' time, and we go, oh no, we've disproven that theory now, and this is what we think, because we're not 100% sure on that part of laminitis at the moment. So that's why I said to be determined. So if we start looking at those two different diseases in a bit more detail so that we understand what's going on in our ponies with equine metabolic syndrome, and then in a minute with our PPID or Cushing's disease. So equine metabolic syndrome stems from, there's a disease in people called human metabolic syndrome. And in people, you have human metabolic syndrome if you have essentially all of these different features. So you have obesity, and it seems to be particularly what we call visceral adiposity. So that's fat that's accumulated around your middle. So it's accumulated around your organs and inside your abdomen. So that's why they say being apple-shaped is far worse for you as far as your health is concerned than being pear-shaped. The people have insulin dysregulation, so they have problems with their body recognizing the hormone insulin as it should do. They have hypertension or high blood pressure. They have changes in the different fats that are in their circulation, so what we call their plasma lipid profile. the people are in a sort of what we call a permanent state of low-grade inflammation. So their body has inflammation going on it all of the time. And they have what's called altered adipokine concentrations. And adipokines are hormones made by fat tissue. Because fat tissue isn't just a store of fat, or sort of calories that when you eat too much calories, your fat actually has a normal job to do in life. It produces lots of different hormones that are very important in your metabolism. But unfortunately, when you become overweight or obese, then it alters the different amounts of the hormones that are produced. And then that generally upsets your metabolism because some of these hormones, what their normal job is to counterbalance insulin. And if you're getting too many of those hormones that actually sort of stop insulin doing its job, then that's when the body becomes upset and the whole balance becomes sort of out of kilter. And in people, if you've got human metabolic syndrome, what happens is you've got an increased risk of cardiovascular disease and an increased risk of type 2 diabetes, which can eventually, if you don't do anything about it, it can be fatal. So what we then found is that there's something similar going on in the horses, hence the name equine metabolic syndrome. And I've tried to, in the two sides of the slide here, kind of line up the different features to show you where they're kind of similar, but not absolutely the same. So a while ago, we thought that all horses with equine metabolic syndrome had to be obese or so overweight or obese, or have what we call regional adiposity, i.e. fat accumulating along the top. So a big fat crest and a big apple-shaped bottom. But we've now discovered that actually not all horses with equine metabolic syndrome are overweight. They can have a perfectly ideal body condition, so they can look fine, but they're still having trouble with their insulin hormone if you look inside them, if you do some tests. So all the horses have insulin dysregulation that have EMS, but only some of them are obese. Some of them also have high concentrations of a particular fat called triglyceride in their blood. And again, having too much triglyceride in their blood can cause them problems. And some of them also have an upset balance of these fat-derived hormones, these adipokines. So there are similarities, but they're not exactly the same, these two diseases. And whereas people get cardiovascular disease and type 2 diabetes, it seems to be that the horses with their equine metabolic syndrome have an increased risk of laminitis. And also, what seems to happen is these horses with their equine metabolic syndrome and their insulin dysregulation, it seems to be that when they go out to pasture and they're grazing, that's what seems to tip them over the edge and trigger their laminitis. So this is where the diet part comes in. And it seems to be conditions, particularly that favor increased sugar content in the pasture, that seem to tip them over the balance and set the laminitis off. Because we all know that the ponies that seem to be fine, you don't do anything different, and then suddenly, bam, that you go out and you find them and they're crippled with the laminitis. Because what it seems to be is that the sugar in the pasture, when the horse eats it, the body's response, so the pancreas' response is to produce insulin. So when the pony eats more sugar, then the pancreas produces more insulin, which means that there's more insulin in the blood. And then if it goes up and up and up, eventually it'll get to that point at which it triggers laminitis in that individual animal. And the trouble is, sort of every individual animal will have a slightly different threshold, and obviously every single blade of grass has a slightly different amount of sugar in it. So it's a balancing act. And equally, we know that whilst diet plays a role, and we'll look at diet in a minute in this equine metabolic syndrome and tipping them over, it's not the only thing. There are other sort of aspects that are causing the insulin dysregulation in these animals as well. And we'll look at each of these in turn. So we've got genetics, epigenetics, the microbiome, the obesity, and the diet. So genetics certainly seems to be involved. It's because we know certain breeds seem to be predisposed. And unfortunately, the breeds that are predisposed are pretty much all of the UK native breeds. So everyone that you can think of seems to be predisposed. Plus, there's some other breeds you can see. I put up a couple of papers there just as examples of some studies that have been done. So, for example, Arabs also seem to be predisposed, the Morgan horses, and some of the breeds that they get that are particular to the United States. So things like Tennessee walking horses, that kind of thing. But pretty much are UK native breeds seem to be the worst offenders. And whilst people have done studies to try and find which exact genes it is, because if we could make a genetic test for laminitis, that would be amazing, wouldn't it? You could get your horse tested, you could know that, okay, my pony is at a high risk of laminitis, therefore I need to put in lots of effort to stop it happening. We're not at that point yet. And it also looks like it's a combination of lots of different genes that are playing the role. So it does not look like it's ever going to be a single gene that's responsible for it that we can test for and get an answer. Then there's something called epigenetics, which is interesting because what happens to us as people, and the same as horses, dogs, cats, whatever, is when you are developing as a fetus, so as a baby inside the mum, the environment that you're exposed to whilst you're still inside switches various genes on and off. And sometimes that's a good thing, and sometimes that has really bad effects for you later in life. So there's lots of evidence for this in people. So, for example, I've got you one example at the bottom there that says worldwide there are 23 million babies born per year to mothers with diabetes. And exposure to that maternal diabetes in utero is associated with a 2 to 3 times increased risk of being overweight or obese as a young child. And then a 3 to 4 times increased risk of obesity or glucose intolerance in older children, and then a likely increased risk of things like diabetes when you're older. So essentially, what happens even before you're born can influence your long-term metabolic health. And I put up there's one study at the moment that shows what happens in horses, and it showed that maternal obesity increases insulin dysregulation, low-grade inflammation, and some sort of joint-related lesions in foals and yearlings. So definitely there is evidence that the same thing happens in horses, that what happens whilst they're inside the mare then influences their metabolic health later in life. We all like the microbiome. That's quite a sort of trendy thing at the moment. It's all about sort of your gut health with your bacteria and, eating, taking the yogurts with the healthy bacteria in them and all of that kind of stuff to try and improve your gut bacteria balance. And definitely there's lots of evidence that the microbiome, so your gut microflora, your gut bacteria, influence metabolism, hormone signaling, and your immune system in people, because those bacteria that are inside you produce hormones themselves that can then get absorbed into your bloodstream. They produce metabolites, so when they're breaking down the food that you've eaten, they'll produce various products of metabolism that then get absorbed into the blood and have effects, and also they produce various enzymes that again get into the blood and have effects. So your bacteria that live in your gut have a big role to play in your health. And there is evidence that the same happens in horses, and it is implicated. I've got a couple of studies that I've shown you there that shows you the effect that it is implicated in laminitis and equine metabolic syndrome, and also that that microbiome can change in response to diet. So it has quite an important role to play. Obesity itself, I already mentioned, has a role to play in insulin dysregulation. I said it produces a whole array of hormones that have a normal jobs to do. So you can see here the normal jobs that your fat-derived hormones do. And if those hormones get upset by you having too much fat tissue and becoming obese as a horse or a person, unfortunately, it can have all these effects. And one of the effects that it can have is on insulin sensitivity. And then finally, diet influences the horse's insulin dysregulation. So as well as being responsible for tipping them over the edge into the laminitis, the diet is also influencing whether they've got the insulin dysregulation in the first place as well. And we know that diets that are high in sugar and starch make a horse more insulin dysregulated, so make it worse. But the response does vary depending on the source of the starch and the sugar. You can see at the bottom right-hand side, I've shown you a paper that shows you, it's entitled The Insulinemic and Glycemic Response of 3 Forages in Ponies. And that's because it seems to be, for example, when they did this study, when they fed the ponies a hay and a haylage with the same amounts of sugar in them, the ponies produced more insulin in response to the haylage than they do to the hay, even though they're eating the same amount of sugar. There's obviously something to do with how the haylage is digested within the horse that makes the horse make more insulin, which is why if possible, we recommend diets based on hay rather than the haylage if you have got a horse with equine metabolic syndrome. Whereas a diet that's high in fat with the same amount of calories as an equal starch diet doesn't make them insulin dysregulated. So again, that's why we say if you've got a horse with insulin dysregulation that needs more calories because it's doing quite a lot of work, then you should give them the calories in the form of fat, so vegetable oil, that kind of thing, rather than cereals, etc. So how do we make a diagnosis of EMS in your horse? We'll go through all of these. So we'll start by taking a history. So we'll ask you questions and try and work out, is your pony or horse overweight because unfortunately it's getting fed too much and it's not doing much activity? Because it's the same with us. If you feed too many calories and you don't burn them up, the excess of calories just gets turned into fat tissue. But certainly it seems to be that horses that do have equine metabolic syndrome, so they've got that underlying insulin dysregulation going on. Owners describe them as easy keepers, good doers. They live on fresh air. They get fat looking at a blade of grass, etc. We'll look at what we call the sigma, which is age, breed, sex. So we've already talked about there being a genetic risk with these certain breeds overrepresented. And certainly most animals with EMS get diagnosed when they're younger, usually before they reach the age of 15 years of age, because by that time they've had at least one episode of laminitis. Whereas you'll see in a minute when we come on to the Cushing's disease, it's a disease of the older animals. We've talked about that the animals may or may not have obesity. And if they do, they might have what we call regional adiposity. And you've got a couple of pictures there. So they, I am ashamed to say, are research ponies that used to live at the RVC with me. And you can see the one at the top has a very large crest on him. And the one at the bottom has very large fat pads on his bottom. They definitely needed a diet, but they were there as research ponies because they had repeated episodes of laminitis. But as I said, you can have what we call a lean EMS phenotype, or essentially a pony that is not fat that can still have equine metabolic syndrome. And this is another of my previous research ponies to demonstrate that. You can see this is her bottom, which is not large. You can just about make out where her ribs are. She had very little crest, but the bottom picture here are her feet, and you can see how many episodes of laminitis by her feet here she's had in the past few months. And this pony had insulin concentration persistently, whatever we did, of 1,000, whereas normally it should be less than 20. And she had episode of laminitis after laminitis, regardless of what we did. So she was the most recurrently laminitic thing on the planet. What are we going to do to test it? Well, obviously we're going to measure insulin concentrations in the blood because that's what's causing these problems. We would start off with measuring just resting insulin concentrations, literally just take a blood sample and measure it. But we have to do it when they haven't got sore feet, because otherwise just having the pain of sore feet can artificially increase their insulin concentrations. And you can see at the bottom here, we have kind of values which are not particularly helpful, because if it's very low, they can still have, at that point in time where you happen to take the blood sample, they can still have insulin dysregulation, but you happen to take it at a point in time when it was low. We've got a suspect. Well, it's up a bit, but it might have it. But if it's high, then we can be sure. So if your resting insulin in your animal comes out as high, then that's helpful. But if it comes out in that middle or low, then we're going to have to do what we call a dynamic test, where we give the pony some carbohydrate, so some sugar, and see what its insulin response in the blood is to that. It's not enough carbohydrate. Some owners get worried that we're actually going to set them off and make them have laminitis, but that's not the case. It's only a little bit, enough that we can measure the insulin response to it and make a diagnosis, but not enough that's going to do them any harm. We can either do what's called an oral glucose test, where we give them this powdered glucose mixed with a little bit of chaff. But you would be surprised. It obviously doesn't taste very nice, because you can get the hungriest pony ever, and the most greedy thing. You have to starve them overnight for about 6 hours beforehand. You feed them this chuff with the glucose powder in it, and they take one look at it and go, I'm not eating that. Because it must be, I don't know, it's obviously not very palatable. Whereas I much prefer doing what's called the oral sugar test, where you give them this corn syrup, which is what's called Caro Light corn syrup, which I learned is stuff that Americans like to put on their pancakes. And the ponies will chase you around the field for this stuff. They seem to love it. It's very sticky. You end up wearing it a bit. The pony wears it a bit, but it seems to be a much easier test to do. And you take their blood before you start, and then you take it sort of a set time later to see how their insulin concentrations respond. And then there's one more test that you might come across, your vet might choose to do, which is called the insulin tolerance test, which is where we inject some synthetic, so some man-made insulin into your animal, and then we see how low that brings the blood glucose down to. And if the body's not responding to insulin as it should do, that glucose concentration won't come down as much as it should do. So again, those are the different tests that your vet might choose to do. We can also measure those adipokines, so those fat-derived hormones. And the one that gets measured in the UK is one called adiponectin. And in ponies or horses with EMS, their adiponectin concentrations are low because that's ones whose production is reduced. In the States, they measure a different one. They measure one called leptin, and the leptin concentrations are high in animals with EMS. And then finally, if your vet wants to, they might measure the triglycerides, so those fat concentrations in the blood as well. And we know by measuring these different things, we can get an idea of the risk your animal has of getting laminitis. So this was a study that I did in conjunction. It was somebody called Ed Knowles' PhD that they did with me at the RVC. And it involved him following, he got a group of ponies. So in total, we had 374 ponies in the group, and we followed them over 4 years. None of them had had any laminitis before at the start that their owners were aware of. And when they got examined, their feet looked fine, they were fine. And we followed them over their 4 years. And over that 4-year period, 43 of them developed laminitis. And then we could look at the various things. We visited them every 6 months and took samples from their blood and looked at their feet, etc. And we found that their risk of getting laminitis was associated with high insulin concentrations, both in the basal, so the standard blood test, and also after the oral sugar test. It was associated with having a low adiponectin concentration and having what we call divergent hoof growth rings. So essentially evidence of subclinical, so a laminitis that wasn't apparent. The pony hadn't been lame before that really bad bout of laminitis, but there was definitely evidence there was something going on in their feet before the owner realized. And you can see we could make them into low, medium and high risk animals based on their numbers. And for example, if we just pick the basal insulin, so the box over to the left here, those with low insulin concentrations only had a 6% risk of getting laminitis in the next 4 years. So that's pretty low. Then we went to 22%, but then the high risk category, nearly 70% risk of getting laminitis. And the same with our oral sugar test result, and the same with our low adiponectin concentrations. But we could only predict it from those things in the blood and the hoof growth rings. We couldn't predict it from the way the pony looked. So it wasn't how fat it was, its body condition score, how fat its crest was, what its girth measurement was, or anything like that, or anything that the owner reported to us. So you can't look at a pony and say you're a high risk laminitis pony. The only way you can do that is by measuring things in its blood, was what our study showed us anyway. So what are we going to do about these animals to try and reduce their risk? Well, essentially, because it seems to be the sugar in their diet that's making their insulin dysregulation worse and tipping them over the edge, well, the answer is to limit their sugar intake. If they're overweight as well, we want to get them to lose weight. And ideally, if you want to control everything that passes your pony's lips in order to control their calorie consumption, then you need to take them off the grass and feed them only hay. I know that is difficult in some circumstances, but this is the ideal. And then obviously you have to adapt it to what works in any individual animal circumstances and what you can achieve on your yard with what you've got, etc. But in an ideal world, you'll feed only hay. You would get it analysed to make sure it had less than 10% NSC as non-structural carbohydrate. But hay analysis is only useful if you are one of these people that can have like a big stack of hay bales and you're going to feed all of those over the next, I don't know, 6 months. If you're buying it a couple of bales at a time and some comes from here and some comes, then that's just not worth it because every bale of hay is going to be different. You're aiming to feed, if we want to get them to lose weight, 1.5% of their current body weight. And we can certainly soak the hay to try and essentially wash out some of that sugar. It won't make every hay have less than 10% sugar in it, but it will certainly bring the sugar concentration down. And the rough guide is for at least an hour in cold water, because again, the sugar comes out quicker if the water's warmer, but that's not feasible on most yards. You've got the cold water tap, and you've got a bin to put it in, and that's your option. Obviously, some of these animals, for whatever reason, you want to feed them something in a bucket as well. You want to feed them breakfast, dinner. Everyone else is getting fed. They're going to get upset if they don't. Then essentially, you're going to substitute, not as well as, you're going to substitute some of that hay for another fiber-based product. So we've got sugar beet pulp, but that's unmolassed. And essentially, that's the bit of the sugar beet that's left behind. That's the fiber that's left behind after the sugar that's been taken out for manufacturing. Or some kind of chaff-based product is fine. Because soaking the hay, as well as washing out the sugar, it washes out all the vitamins and the minerals, and also some of the protein. Then they need just a standard vitamin, mineral, low protein supplement. Nothing fancy, just a standard one. And you need to do some kind of monitoring of their weight loss. So again, whatever you can achieve, you weigh them. If you've got the luxury of the scales, you weigh tape them, you just measure them, you take a photograph, every 30 days, something that helps you monitor their weight loss. It's always weight loss plus exercise. So if they are sound, so if they don't have laminitis, they don't have other lameness reasons, etc., then exercise is as good for the horses as it is for us. Because it sort of helps improve the muscles to use glucose, and it helps improve the body's insulin sensitivity. And essentially, you need regular and sort of light exercise, ideally. If your animal can do more exercise, then that's perfect. What do you have on top of your popcorn? What do you have on top of your popcorn? But we need regular exercise at least 5 times a week. So that's not nothing all week and loads at the weekend to make up for it just in case. Ideally, as often as you can. We all like a drug to fix these things. If we could take a pill and make it go away, for us as people, if we didn't have to do the diet and the exercise, as well as for our animals, that would be perfect, wouldn't it? But the medical therapy is only used in the short term, so the first 3 to 6 months, either whilst the management changes take effect, if you've got a really laminitic pony and you want to do something really quick to try and bring its insulin concentrations down in its blood quick, or you've tried it like that and you're absolutely hand on heart, you've tried it and the pony's not responding, because we do know that some of them are what we call weight loss resistant, then you can start reaching for the drug. So about 10 years ago, the drug that every pony that was put on was metformin. So you might still see it now. This was a human diabetes drug that got used, and in people, it does a lot of good. It improves the people's insulin sensitivity. It decreases their insulin concentration. It does what it's meant to do. But it got given to a very, very large amount of horses and ponies in the UK before we realised that actually, when we give it to horses, they only absorb 7% of the dose into their body. The other 93% comes through the horse and out the other end onto the stable floor in the droppings. So the vast majority of it never even gets into the horse because they just don't absorb it. And then we did some study to see whether does it improve insulin sensitivity in our horses, and the answer was that no, it actually does nothing for a horse's insulin sensitivity. There's only one study that maybe it works at the level of the actual cells in the gut and reduces glucose absorption, and therefore if you absorb less of the sugar, then you have less of an insulin response to it. But essentially, there's not much evidence supporting the use of metformin. So the vast majority of vets have moved on from using metformin. One that, again, has got tried and is more popular in the US than in the UK is the hormone thyroxine. that you might have heard of people being hypothyroid or dogs hypothyroid. When your thyroid itself, your thyroid gland is not producing enough thyroid hormone, then you would take a supplement to bring you back up to normal thyroid levels. But these horses are not hypothyroid. They're not lacking in thyroid hormone. But the idea behind this treatment is that you give them extra thyroid hormone, because the job of that hormone is to speed up your metabolic rate so that you burn up more hormones, more calories, sorry, and in that way you lose weight. But the risk of that is, one of the side effects is what we call hyperphagia, i.e., you're more hungry. So the ponies become ravenously hungry, and so they want to eat more. So if you don't restrict their calories, you'll just speed up the metabolic rate, but they'll eat more, so the two just balance each other out. So it's kind of pointless. And also, you have to wean the horse off once because the thyroid gland makes less of its own thyroid hormone because you're giving it artificial ones. In the UK, as vets, we have what we call a prescribing cascade. So we have sort of a route that we have to follow when we're picking the drugs to treat your animals with. We have to start off with drugs that are what we call licensed, so they're approved for use in horses. And then the next thing in our cascade is, if there's not one that you can use in a horse, you have to look for ones in other veterinary species. And there is a dog tablet, but that dog tablet contains meat flavoring. So it's not really great to be feeding meat flavoring to horses in the UK, because horses are still considered, even though most of us wouldn't, food producing animals. So you're not allowed to feed meat to food producing herbivores. So instead, we can consider either the human preparation, or there are some companies in the UK that make what we call specials. They sort of manufacture drugs specifically for the horses, but they've not gone through all the sort of rigorous testing to get them an actual sort of approved for that use. But the drugs that are getting used with the most frequency at the moment are what we call the SGLT2 inhibitors that you may well have come across. And again, this is another type of drug that's been used to treat type 2 diabetes in people. And the way it works in people is it works on your kidneys, and it stops your kidneys once your kidneys have filtered all of your blood to try, and what happens is everything gets filtered by your kidneys, and then the kidneys gradually reabsorb the bits that you want and you need. But what happens with this drug is that they stop the kidneys reuptaking that glucose. So it means that you lose a lot of glucose in your urine. Essentially, you wee out all your glucose. And in losing the glucose, therefore, the body makes less insulin because it doesn't need the insulin hormone to control those high glucose concentrations. So there are some studies of using these drugs in horses. So I've got the drugs are there, the canagliflozin, atugliflozin, velagliflozin, and dapagliflozin. And the trade names are in the pictures on the right-hand side. So you might have seen them as Invokana, Steglatro, etc. And there are some studies that have shown that there is some success with using these drugs in small numbers of animals that have got very severe insulin dysregulation. And they do seem to decrease the insulin concentrations in most animals, but not all. They do seem to improve their laminitis pain when they're in that really acutely painful laminitis time. But they only work if you use them in conjunction with diet. Obviously, you can't do the exercise because these are animals with active laminitis going on. And if they have the Cushing's disease as well, you have to continue their Cushing's disease treatment, because otherwise they don't work if you don't do the diet and the Cushing's treatment. But some sort of cautions to those drugs is that we don't really know how they're working in the horses, because the way that human diabetes is and the way that equine metabolic syndrome in horses is, they're not the same disease. So we don't 100% understand how they're working. The dose that we're using in horses is entirely extrapolated from people. We go, well, we'll give this much to the person, we'll give this much to the horse. So we don't really know whether that's the right dose. Not all horses improve. So some, the insulin doesn't come down. There are side effects. So it can make the concentrations of this fat called triglyceride in their blood go really high. And if you remember, some horses with metabolic syndrome already have a high fat concentration. So these drugs can make it go even higher. That might be dangerous. And there are some cases where these drugs have caused liver damage as well. So the advice is that they should only really be used in horses that have not been responded to diet and exercise, where you've given it a really good go, or those that have really bad active laminitis, that you need to do something really acutely. And you still need to do the diet and the exercise. It's not a substitute for that. And these horses need to be monitored. So you've got to be prepared to sort of do the blood tests and monitor their liver, and these fat concentrations in their blood, and watch out for signs of the animal getting sick. We all love a supplement, so there are a million and one out there that are advertised that will improve insulin sensitivity, prevent laminitis, but unfortunately, there is no scientific evidence to support the use of any of them. So they're probably not doing any harm. They've got combinations of chromium, magnesium, cinnamon, chasteberry, etc., but they're probably not doing any good either, is the honest answer. And then just to finish it off, because that was mostly how we deal with our animals that are overweight with equine metabolic syndrome. Obviously, those that are the lean ones, we're not having to put them on a diet per se. We don't want to make them lose weight, but we still want to give them a low sugar carbohydrate diet. And if they need the calories, that more than the calories that can provide, then we're going to provide them in the form of fat. They still need the balancer. They still need the exercise, and they may need the medical therapy if the diet and the exercise alone doesn't work. And then we're going to finish off by looking at the PPID, or the pituitary pars intermedia dysfunction, which has had lots of names in the past, which probably the one that you know it best at is equine Cushing's disease. And again, as a reminder, well, how does it work? How does the disease occur? Well, it's a disease of something called your pituitary gland, which is a little gland at the base of the brain. You've got one, your dog's got one, your horse has got one. But again, its job is to produce a variety of hormones in response to something called the hypothalamus, which is part of your brain. And the pituitary is divided into different areas, and one of the areas is called the pars intermedia, and it's that area that's affected, hence the name pituitary pars intermedia dysfunction. And what happens is this area of the pituitary loses its off switch. So it means that the inhibition that comes from the brain, from the hypothalamus, gets lost. And we don't know how those nerves from the brain to the pituitary get damaged. We don't know what the cause is, but it seems to be slowly progressive. So they start off sort of a bit affected, and then over time it gets worse and worse and worse, which is why these animals with Cushing's disease eventually get to the point where the therapy doesn't help control it anymore. And because this area of the pituitary loses its inhibition, or loses its off switch, it just produces loads and loads of hormones. It just continues to chuck out all the hormones. They're normal hormones, but there's just too many of them. And whereas the EMS, we said, was usually diagnosed less than 15 years of age, the PPID, or the Cushing's, is a disease of older animals, and the average age in studies is about 19 years of age. It's rarely reported in animals less than 10, and the youngest ever report is in a horse age 7. So if you've got a 3, 4, 5-year-old, then you don't need to think about Cushing's disease. Think about EMS, but don't think about Cushing's disease. But as the animal becomes older, it becomes more and more likely. So we've got a couple of studies there. So it was 14% of animals were affected in one retirement centre, and 21% of the animals over 15 years of age in another study in Australia. No sex predilection, so mares, geldings, the same. And other than ponies, more likely than horses, it's no particular breeds. And we've got some signs there, and they're divided into signs that occur earlier on and signs that occur later, because I said it's a progressive disease. And we've got some signs that what we call strongly suggestive, some that are suggestive, and some that maybe. But the one that is most suggestive of PPID or Cushing's disease is change in the hair coat. And the technical name is hypertrichosis. So essentially, that's when they look like they've got a winter coat all year round. So it gets to the summertime and they don't lose that coat as they should do. Other signs we've got loss of the top line muscle, we've got lethargy, abnormal sweating, so they might be hairy and sweaty, and they might drink more, they might urinate more, and they may well get the laminitis. So the laminitis only occurs, we thought it occurred in all animals with PPRD, but now we know it's actually probably only somewhere between a quarter and a half of the animals with PPRD actually get the laminitis. They obviously get all the other signs as well. And it seems to be those with the laminitis are those that have insulin dysregulation going on, so problems with the hormone insulin inside their body. And we think it's probably some of the hormones that are being overproduced by the pituitary are affecting insulin's ability to do its job. Therefore, the body makes more insulin, so the blood insulin concentrations go really high, and therefore then that gives them laminitis. And obviously, this poor pony has got some really severe laminitis going on, as you can see. I mean, it's pictures, and you can see it's got its long, hairy winter coat on. This is a very typical pony with PPRD. Other clinical signs, this was one of the teaching ponies that we had at the RVC. She recently got put down because her PPRD was getting worse and worse. But you can see on the picture on the left, this is summertime, and she's retained some of her winter coat here. She's looking pretty skinny, so she's got weight loss, and she's kind of lost all the muscle along the top line. She's got atrophy of her muscles. So how are we going to make a diagnosis? So we're going to base it on the history, you telling us what the horse has been doing and the fact that it's an older animal. We're going to base it on those clinical signs that we've talked about, and then we're going to do some tests to make a diagnosis. So the first test that your vet will try and do is measure one of the hormones that's produced by the pituitary gland called ACTH. You just take a single blood sample and you measure it, and the result varies both in normal animals and ones with PPRD with season. So this blue line in our graph is our normal animals, and the red line is the animals with PPRD, because this is a hormone that helps prepare the animal for winter. So they have a rise in those hormones in the autumn time when day length is changing, etc. But it seems to be that obviously all year round the ACTH is higher in animals with PPRD, but it's a lot higher in the autumn. So sometimes the autumn is the easiest time to make the diagnosis on the blood tests. Sometimes we can't, the result from the basal ACTH test isn't very obvious, so we can do what's called a TRH stimulation test, where we kind of stimulate the pituitary to produce lots of hormone, and we measure the response of the ACTH in the blood to that. We should check for insulin dysregulation in all our animals with PPRD, because those are the ones at risk of laminitis, and we use the same tests as we would do in our EMS animals. So we measure basal insulin concentrations and then maybe do an oral sugar test to find out. And then we are going to try and, well, we can't cure these animals, but we can manage them. Some owners don't want to specifically treat them. They don't want to embark on expensive lifelong drug therapy, but it will depend on what signs the pony's got and how severe they are. For example, if it's just retained its winter coat and it's a bit sweaty and drinking more and weeing more, then you can manage those a lot more easily. It's usually the laminitis that means that the animal actually has to have specific PPRD treatment. And there is actually a drug that is what we call licensed for use for treatment of this disease in the horse. I'm sure you've all heard about it. There's lots of different makes. The first one was called Presend, but there are other ones now. There's Paraquin. There's various ones that essentially have got the same drug inside them. And it works in about sort of 65 to 85% of cases. So it's pretty effective. There is a few animals do get side effects. The most common one is anorexia, so they stop eating. So sometimes you have to stop the drug, let their appetite return, and then start them off at a lower dose and start them off again. Some ponies refuse to eat it, however hard you try to hide it wherever you can. So there is what we call an extended release weekly injection of a drug that's very similar called cabergoline that you could now try if you wanted to. Again, it's not a licensed product, but there is a company in the UK that makes it so that you can try. Again, we're going to try and do diet and exercise in these animals. Diet's important for everything, but exactly what you're going to need to do will depend on the animal's body condition score. So is it one of the animals that's got weight loss and is quite skinny? And also depends on its insulin results. So we've got different combinations depending on whether it's lean, obese, insulin sensitive, or insulin dysregulated. But whatever you do, you obviously need to monitor them, monitor their weight, monitor their body condition score to make sure they're either putting on weight or losing it, depending on what you're aiming to do. We need to monitor these animals. We monitor their blood tests to see what those ACTH hormone concentrations are doing and how their clinical signs are doing. And then depending on how they're responding, we may choose to increase the dose or stick at it. But these animals, they need lifelong treatment, lifelong management. We're not curing it. We're just trying to help control it. But that said, there was a study that they did in the US when they were trying to license the pergolide, and 50% were still alive at the 4.5 year point, which is pretty good in these older animals. But it's the laminitis that's usually the reason for euthanasia. And then finally, just to make life extra complicated, some ponies can have both. They can have EMS and PPID. And therefore, you've got to try and juggle the management of both and try and manage the aspects of both to try and keep everything under control. So it's not impossible for your vet to tell you that your horse has EMS and PPID. So thank you very much. Hopefully you found that interesting. And as we said at the start, if you've got any questions, then type them in the chat and I will do my best to answer them for you. I will stop sharing.
Thank you, Nicola. That was really interesting. I've got plenty of take-home messages from that. I can assure you. Do we get any questions on there, Liam?
There's no questions on the chat yet, so could I start with a question, please?
Yeah, go for it.
In relation to the sepsis-associated laminitis, if you see a lot of cases at the RVC, have you noticed the number of cases increasing due to sort of diet, lack of work, over rugging? And I think what I mean is more of the horses kept as pet scenario rather than horses kept to work and be ridden. Have you seen those numbers increase?
For the sepsis-associated laminitis specifically?
With relation to the colic and that kind of thing.
No, I don't think so. Unfortunately, touch wood, fingers crossed, we don't see that many because I didn't mention because it's not the commonest type of laminitis and pretty much the prevention stuff we're doing when they're in with us in the hospital rather than the owners or the farriers at home. People did some research relatively recently by showing that you can use what we call its posh name is digital cryotherapy, but essentially it's using ice. To cool their feet. So if you know you've got an animal that's at risk of it, so it turns up with us, we diagnose, for example, it's got a small intestinal strangulation going on inside it. We need to take it to surgery. So therefore we know that that animal when it's recovering from its surgery is at increased risk of laminitis. We will then put ice on its feet. So the best way we find of doing it, we get essentially really thick plastic bags that we've used. They did have intravenous fluids in it that we've given to a horse before, and we've got the bags left over. They're like 5 litre bags. We can fill the bags with ice. You put them on the horse's feet, and then you duct tape them around the level of the plastic to the horse's feet. You would have thought a horse would freak out having 4 plastic bags duct taped to its feet, but I think because they're pretty sick at that stage, they don't seem to notice. They're too busy on worrying that their stomach hurts, etc. And certainly if we do that for up to 72 hours in that first initial period when they're at that most risk, it certainly seems to help a lot. I mean, we still to get a few cases, but fortunately, it's relatively rare.
Okay, cool. Thank you. There is a question from Kim Lacey. What is your next goal for a study and what basis would you take into consideration?
Oh, we've got lots of questions that we're trying to answer. So if you want to give me lots of money, then I can do lots of research. At the moment, we've got people. I've got somebody working on. So we mentioned the hormone adiponectin. So one of those fat-derived hormones, and that having low concentrations in the horse's blood meant it was an increased risk of laminitis. So as well as having high insulin, low adiponectin was bad. So we're looking at how that lower adiponectin is bad, and whether there's a way is there some kind of way that we can bring it up? Is there some kind of treatment, some kind of drug that we can use? And in making adiponectin come up as well as insulin come down, will that have a doubly beneficial effect? Is something that we're trying to do at the moment.
Oh, thank you. We've got some more questions coming in now. Duncan Cooper. Is there any major differences in steroid-induced laminitis?
Okay, so steroid-induced laminitis, it comes under the heading of endocrinopathic laminitis. So what steroids are is, the proper name is corticosteroids. And they're a drug that we use to treat horses for a whole variety of conditions because they are essentially a very potent anti-inflammatory drug. But in your body, in the horse's body, you have the hormone equivalent called cortisol, hence corticosteroids, cortisol. And in normal metabolism, cortisol and insulin sort of work against each other to try and have a balance. All hormones in the body kind of have ones that they work against. So if you give the horse cortisone, corticosteroids, whatever you want to call it, essentially synthetic cortisol, so you make your cortisol go up, the body's reaction is to make the insulin go up to try and keep everything in balance. So that's where the laminitis risk comes in. So it seems to be, from all the literature that's out there, all the studies, that if you have a perfectly healthy horse, it's never had any laminitis before, so it's not got EMS, it's not got PPID, it's not had laminitis that you know of, it's not overweight or obese. So essentially it has no other what we call laminitis risk factors. There is no risk associated of treating it with steroids. At that point, the horse seems to be able to cope with steroid treatment for whatever reason. But it's these animals that already have laminitis risk factors that if you add in the steroid therapy, then it seems to tip them over the edge and make them at risk of getting laminitis. So it wouldn't ever stop us using them as a vet, but it would mean that we would have that conversation with the owner going, look, this is a real risk. But for example, we might use steroids in a horse that's got really bad asthma. So if it's struggling to breathe because its asthma is so bad, well, if you don't give it the steroids so it can't breathe, well, that's not really compatible with long-term life. So we have to give it the treatment and take the risk of getting the laminitis. But, if you're giving it for a fairly minor reason, so for example, we use quite a lot of steroids in joints for lame horses. But there might be something different that you could use. You might have the conversation with the owner and go, well, actually, rather than the steroids, we can try, there's lots of what we call biologic products or, things like hyaluronic acids. And, you say, well, we might try one of those products first because they might work. And if they don't work, then we'll take the risk with the steroids.
Thank you. I'm just going to skip one a second. Claire McLeod, please can you explain the pathophysiology of steroid-induced laminitis? I think you might have just answered that. So Claire, let me know if that's covered your question. So we'll come back up. Nigel Brown, if an equine has had EMS for many years, do you think they are more likely to develop PPID?
That's certainly, again, that's, I said that I'm going to tell you lots of things that we think about and we don't know for sure. Yes, we think it might be, because what we think is sort of all the changes that are going on in the horse's body whilst it's got EMS might also be affecting its pituitary. So there is certainly some evidence that horses that they seem to have EMS for a while and then they get PPID or Cushing's disease. But actually, we don't really know. Maybe it was going to get Cushing's anyway, because, as time goes on, the likelihood of an individual animal getting Cushing's goes up because we know it's an age-related disease. So I think the trouble is because we don't 100% understand how the pituitary loses its off switch in Cushing's, it makes it quite difficult to go, well, it does EMS make PPID more likely? So I think the short answer to that is yes, quite possibly, but can I tell you categorically the answer? No.
Okay. Yeah, thank you. Deborah Leavita has asked, Leavita, are there more cases of EMS than, say, 50 years ago, or are we just diagnosing more? If there are more cases, are there aspects of modern management, for example, pasture, nutrient levels, that may be contributing to the increased incidence?
I think it's a bit of both.
Okay.
So now we know to look for it. Now we're looking for it, but because 50 years ago, we didn't know that insulin was important. We knew ponies got laminitis. I mean, laminitis has been around for centuries. But we didn't know it was insulin. The first inclination, like I said, was about in the 1980s. But also, you've got to think, horses used to actually work quite hard for their life. They used to plough the fields, they used to pull cabs, they were working animals. They weren't ornamental grass cutters that a lot of them are now. So some of them work very hard still, but I think a significant proportion don't actually do an awful lot. They spend 23 and a half hours a day stood in the field grazing, and they might do half an hour of light work. So, and, we keep them in lovely fields. They're dairy pasture. It was meant to be for dairy cows, high producing dairy cows, and now because there aren't the dairy cows around in Hertfordshire where I am, we put the ponies on there instead. So we've got the ponies. If you think about a Welsh pony, Welsh mountain pony, where it's meant to live on the Welsh mountains, it's meant to work really hard for its diet. It's meant to spend 16 hours a day foraging and walking miles a day to try and get all the calories it needs, and with the rain that's horizontal with no rugs on and all the rest of it. So we certainly make the pony's life a lot easier. We rug it up to keep it warm. We put the grass on a plate in front of it. We give it breakfast, lunch, and dinner. We don't ask it to do work very hard. So yeah, I think it's a bit of both.
Okay. Yeah. Thank you. Is there any more laminitis based questions? There's none come in.
Is that it? Is that it then, Liam?
Not quite. I think I've got another question from Kim Lacey. I was just going to see if there's any more laminitis ones. Not yet. So send them in if you've got them. Oh, hang on. Sorry, one you want.
What about frosty grass? I can
Yeah.
see it's popped up. So the frosty grass is that when it's cold and bright and sunny, which is kind of when the frost happens, is the sunlight is there. So it's all to do with plant photosynthesis. So when it's sunny, grass plants photosynthesize, so they take the sun and they make sugar inside the grass. But when it's too cold, the plant then can't grow because it's too cold for it to grow. So it makes the sugar, but it can't use it up in growing. So it means that the sugar accumulates in that frosty grass, which is why we say that frosty grass it increases the risk, because it means that in each blade of grass there's more sugar content. But the whole kind of pasture management is all to do with, well, there might be more sugar in each blade of grass, but it depends on how many blades of grass there are out there for the horse to eat and how long you leave it out there for, etc. Because yes, if it's frosty, but it's pretty short and it's pretty sparse and there's not much there, then the overall amount of sugar the horse can eat is fairly low. But obviously, if you've got lots of frosty grass and it can tuck in, then that might add up to quite a lot of sugar.
Brilliant. Thank you. Good question there, Oscar. So one last question then from Kim, and I've lost it. Sorry, bear with me. Okay, Kim Lacey, how would someone get involved with studies at the RBC? And I think that might be on the basis that you used to run a course for farriers, didn't you, that we don't see so much of anymore? Do you think
Yeah,
that's something that will grow in future?
we've stopped the farriers course just because there wasn't the interest in it. So I think we
Okay.
ran it a couple of times. So we pretty much everybody that was in the UK that wanted to do it did it, and then we didn't really get people that wanted to sign up for it after that. So we could, I mean, we run it again. If you wanted your pony to be involved in a study, when we're looking for animals for whatever it is, whether laminitis or other things, we do have our RVC website that we post all the studies that we're doing on there. So quite often we will post on there, we're doing this study. If you want to get involved, do this. We've got the RVC Equine Facebook page as well. So if we've got studies that we might not want your pony, but we might want you as a person, as a horse owner to be, or a farrier to be involved in. So we might say, we're doing this project on PPRD. Can you fill in this questionnaire for us? So we do have opportunities. We do often ask people to get involved. There was also one question I did see about using Manjaro, so the weight loss jabs in horses. And I did look that up. And the way they work is they work slightly different to the SGLT2 inhibitors. They work on what we call gut-derived hormones, the hormones that work inside you called GLP. And people have done studies to see how that GLP hormone works in horses, and you seem to get conflicting results. So some studies show that yes, it does improve insulin sensitivity and might be beneficial, and others show that actually it makes it worse. So I think we're not at the point where we've got enough evidence to show that those weight loss jabs we should try on the horses. So I think let's stick with the SGLT2 inhibitors at the moment if you need some drugs, but obviously can we start with diet and exercise first before we reach for the drugs?
Thank you. It was quite a good question, actually, wasn't it?
Yeah, it's very it's very topical.
It is, yeah, yeah, yeah.
And also think how expensive it would be. Like in people, they're paying hundreds of pounds, aren't they? So if you then, that's, I don't know, just say 100-kilo person, but you've got a 500-kilo horse. So, you've got to times everything up by 5 times for the horses. That's a lot of money.
Yeah. Can we just ask one last question from Claire McLeod because she did
Yeah,
give us a really good couple of talks on nutrition. Have you had any cases of SGLT2 inhibitors
yeah.
causing exercise intolerance? Ridden won't sound again. I've had a few clients report this. I'd advise them to go back to their vet to discuss. I'm in nutrition.
Not that I've heard of. So the main side effects seem to be related to making their fat concentrations, so their triglyceride concentrations in their blood go scary high, to concentrations that if I measured that in a horse that wasn't well, then I'd think that maybe that was what was causing it. And also, there's been reports of colic in a couple of cases, so abdominal pain. And there's been a couple of reports again of liver damage, and even some reports of horses actually ending up being euthanized because of the side effects of the drug. So I guess it's realizing that the drugs are, it's the same with anything, the drugs are not totally innocuous. So yes, in a lot of animals, they've been shown to be beneficial, but they do have these potentially fatal side effects as well that we as vets need to warn owners, and we need to be aware that it's not a sort of a without risk drug. It's a weighing up the risks and the benefits of all of these drugs, and everything that we do when it comes to laminitis in these animals, isn't it?
Yeah,
Brilliant.
very much. Over to you, Dan.
Thank you for that, Liam, for fielding those questions. I was a bit worried we weren't going to get any for a minute, and Nicola was going to go home early.
So
Um,
right, everyone got going, so
yeah,
that's fine.
no, that's been great. Thanks very much for your time, Nicola, tonight. It's been really informative. I hope everyone's enjoyed it. Um, Everybody, follow our socials to find out our up and coming CPD events. Thanks everyone for coming. Enjoy the rest of your evening. Once again, thank you to Nicola. It's been great. And if you could all leave very quietly, because we don't want to wake Phil up. There's a guy on the chat, Phil. So if we can all don't slam any doors.
He's fast
Um,
asleep.
well, I hope it's just sleeping.
But yeah, so hopefully.
Christ.
Yeah.
Yeah,
So no, brilliant. Thank you guys once again. And we'll hopefully see you all soon. Thank
yeah.
you.
Thanks, Nicola. Thank you very much.
Thank you very much. Bye bye.